It's a clinic serving thousands in Kern County for more than 20 years. But if the partial government shutdown continues, they say they'll have to close their doors for good.
23 ABC's Josh Sanders spoke with the Bakersfield American Indian Health Project on why they say the shutdown is affecting more than just access to health care. Josh?
Yeah, Tim, Jess, the Bakersfield American Health Project located behind me has been serving an often forgotten community in Kern County for over 20 years. They say if this partial government shutdown continues, they're going to have to close their doors by the end of next month, not only affecting access to health care, but they also tell me it impacts their community.
The Bakersfield American Indian Health Project sits on the corner of 30th and I Street. For over 20 years, the project has provided health care to an often forgotten people in Kern County.
We take care of all the Native Americans in Kern County and Bakersfield specifically, but any of the outlying areas that we provide transportation to patients, go get them and bring them in.
Dan Tatum served in the Medical Corps for the United States Air Force and for the past 18 years has served as the project's chief executive officer. He says 75% of the project's funding comes from federal dollars, helping to provide health care to over 3,500 Native Americans around the county.
We belong to all the tribes, and we're urban, and we're funded under Title V. And that's what's got us in trouble now, because the Title V money is what the president is holding.
Tatum says the project also uses supplemental grants to fund diabetes and behavioral health programs. But if the shutdown continues, the money will only last through the end of February, putting the project at risk of closing and causing its 11 employees to lose their jobs.
This place isn't just a medical. It brings together people.
Gene Albitri serves as treasurer for the project. Growing up on a ranch outside of Bakersfield, his Deguino Nation heritage gave him an appreciation for his native culture, an appreciation Albitri says the project cultivates.
There's a lot of cultural stuff that goes along with education, because when you're talking about health, you're talking mind, body, spirit, the whole setup. And so this place kind of tries to fill in all of those types of things.
So until the end of the government shutdown or the end of February, Tatum and Albitri will continue serving Kern County's vulnerable, hoping our nation's lawmakers can find a solution and reopen the government.
We don't wish this to close. We wish everything, but we also understand it's kind of out of our hands. So we do what we do. We can only do what we can, and hopefully the Creator will look on us.
Now, Tatum tells me the project is getting support from organizations in San Francisco and Los Angeles, but also here in Kern County. This morning, after a phone call from Mayor Karen Go to Adventist Health, Adventist Health has decided they're going to donate prescription drugs to the project until that government shutdown does end or until money runs out by the end of next month.